Today, I'm breaking down the four main parts of Medicare Parts A, B, C, and D for 2026. We're going to review who actually needs Medicare and who doesn't. We'll review the costs associated with each part of Medicare, which some costs are dependent upon your income. We'll review how these parts of Medicare actually work in practice, as well as review the main choices that you have to make when it comes to these parts of Medicare. And you do have to make some pretty important choices. So if you are turning 65, you know someone who's going on to Medicare, or you just need a little refresher, this is the video for you. Hi, my name is Stephanie Apt. I am a licensed independent Medicare insurance broker. My team and I help seniors all over the country to understand and navigate the world of Medicare. Today, I'm going to explain the four main parts of Medicare, and you want to think of this as Medicare translated. I know how confusing all of these different parts of Medicare can be, and I want to break it down into simple, easy to understand terms for you. If you're not familiar, Medicare is a government health insurance program for people age 65 and over, and certain people under 65 with disabilities. You're generally eligible for Medicare on the first day of the month that you turn 65. And while we're breaking down four parts of Medicare today, A, B, C, and D, really the two main parts to Medicare are Part A and B. This is what's known as traditional Medicare or original Medicare. So let's start with Part A. Part A is your hospital insurance coverage. For most people, Medicare Part A is free as long as you've been living, working in the US for about 10 years or 40 quarters. So Medicare Part A is going to cover your inpatient hospital stay, things like skilled nursing facility care. And then there's Medicare Part B. Medicare Part B is your medical insurance, also known as your doctor insurance. And Medicare Part B isn't free. Most people do have to pay a monthly premium cost to be enrolled in Medicare Part B. And in 2026, most people will pay $202.90 per month to be enrolled in Medicare Part B. Although some people might pay more, Medicare Part B is income dependent. So there is a chart on the screen right now that reviews IRMA, also known as income related monthly adjusted amounts, for both Medicare Part B, your medical insurance, as well as Medicare Part D, your prescription drug insurance. And we're going to get to Medicare Part D a little bit later in this video. What you need to know right now is that depending upon your adjusted gross income on your tax return for 2024, Medicare will look at that number to determine your 2026 Part B and Part D premiums. A lot of people will say to me, well, in 2024, my life was different than it is now in 2026. Maybe then I was working and now I've retired. So there is a way to appeal these IRMA charges. There's an IRMA appeals form that you can use. I've linked it in the video description below, where you can check a box stating that you've had a life change. You can provide proof of that change. And typically Medicare will lower your premium as long as you have reasonable proof of that life change. If you're someone that's needing to appeal these IRMA charges, I found the best way to do it is to go down in person to your local Social Security office. Now, you don't have to. You can also mail in this appeals form, but if at all possible to get an appointment at the Social Security office, that's typically the best way to get your IRMA waived or lowered if you've had a life change. So like I mentioned before, Medicare Part A and Part B are the two parts of original Medicare, right? And you're eligible generally the first day of the month that you turn 65. However, not everyone who's turning 65 needs to or should enroll in Medicare. And I know that when you're approaching turning 65, you start to get a ton of mail, phone calls, you're seeing all of these warning symbols. You have to apply for Medicare or else you'll get a penalty when you're turning 65. However, what many people don't realize is that if you are still actively working past age 65, you have health insurance through your employer, and your employer has 20 or more employees, then you can and often should delay enrolling in Medicare and you won't get penalized. You should at least delay enrolling in Medicare Part B, since Part B comes with a monthly premium. And if you're still working and you have health insurance through your job, generally you don't need Medicare Parts A and B. It doesn't coordinate benefits well with your employer insurance, and it's typically not to your advantage to have it. Again, you would have to meet all of these criteria in order to delay Medicare past age 65. And I do have a video that I've linked below that goes into more depth about delaying Medicare, what to do when you're ready to enroll in Medicare if you're past age 65. So be sure to check that out if this sounds like you. Also important to note that being self-employed or being on COBRA coverage or being on a retiree health plan doesn't count as creditable coverage generally for delaying Medicare. So in other words, if you are on COBRA or you have a retiree health plan, you generally do have to apply for Medicare when you're very first eligible at age 65, or you could face penalties down the road. Okay, so let's say you do want to apply for Medicare at age 65. How do you do that? Well, what you'll want to do is enroll in Medicare during your initial enrollment period. This is a 7-month window. It starts 3 months before the month you turn 65, includes your 65th birth month, and goes up to 3 months after the month you turn 65. And during this initial enrollment period window, you can apply for any of the parts of Medicare, Part A, B, C, and or D. If you apply before your 65th birth month, then coverage will start on the first day of the month that you turn 65. But if you ever get to, you can apply within your birth month and up to 3 months after, and coverage generally starts the first day of the following month. If you're someone that is drawing Social Security benefits prior to turning 65, then Medicare actually automatically enrolls you in Parts A and B. You don't have to do anything. Medicare will send you your red, white, and blue Medicare card in the mail. You'll usually get it a few months before you turn 65, and you don't have to apply for Parts A and B online. Along with that red, white, and blue card that they send you, they also send you a form where you can fill it out to decline Medicare Part B if you don't want or need it yet. And if you're not yet drawing Social Security benefits, then you do actually have to apply online for original Medicare Parts A and B. And you can do that at ssa.gov/Medicare. You'll have to create a socialsecurity.gov account if you don't have one already. And this is the application that you'll use to apply for Medicare Parts A and B. Now, this application won't ask you if you want Part C or Part D or a Medicare supplement plan. You don't need to know any of that yet. Just want to use this online application to apply for Medicare Parts A and B. Additionally, if you only want to apply for Part A, the free portion of Medicare, then you can use this same application. There's a question on the application that asks you if you want Part B, and you'll check yes if you do, and you'll check no if you don't. If you check no and complete the application, you'll be enrolled in Part A only. Let's say you go ahead and enroll in Medicare Part A and B online. You're turning 65. Now what? So what does that cover? What doesn't it cover? And what do you need to do next? That's what we'll review. Well, the good news is that traditional Medicare Parts A and B, it covers a lot, and it allows you to see any doctor anywhere in the country that accepts Medicare. So once you're enrolled in original Medicare, you get your pick of any Medicare doctor, which most doctors take Medicare. It covers many preventative and diagnostic services, but it doesn't cover everything at 100%. So if you just enrolled in Medicare Parts A and B, traditional Medicare, and nothing else, you would have certain out-of-pocket deductibles, copays, and coinsurance amounts that you would be responsible for. So let's break down how that works. When it comes to Medicare Part A, there is an inpatient hospital deductible of $1,736 per benefit period. And a benefit period is 60 days. So it's not like that's an annual hospital deductible. It is a hospital deductible that resets every 60 days. Additionally, Part A has co-insurance that you're responsible for if you have an extended hospital stay. In 2026, you have to pay $434 per day for days 61 through 90 if you had a long hospital stay. If you're in the hospital past 90 days and you have to use your lifetime reserve days, you get 50 of those, and you have to pay $858 per day if you are in the hospital for an extended stay using your lifetime reserve days. Additionally, Medicare Part A covers your first 20 days in a skilled nursing facility, but if you have an extended stay in a skilled nursing facility, then you have to pay $217 per day for days 21 through 100. And that's just for Part A. When it comes to Part B, which Part B covers doctor's office visits, diagnostic testing, outpatient services, ambulance services, durable medical equipment, a whole slew of services are covered by Medicare Part B. Aside from routine preventative care, which Medicare Part B typically covers in full, you do have an annual deductible that you have to pay for any type of Part B covered medical service. And this year that deductible is $283 per year. So that means you have to pay the first $283 of your doctor outpatient medical expenses. And then after that, Medicare pays 80% and you have to pay the other 20% of your other Part B covered medical services. 80-20 is okay, but there's no cap on that 20%. So if you had something very expensive, like let's say chemotherapy or an expensive outpatient cost, you would have to pay 20% of the cost of that, and there's no cap or limit on that 20%. So for seniors on a fixed income, a lot of these out-of-pocket copays and coinsurance and deductibles could be very detrimental. And for this reason, most people on Medicare will want to look at some type of gap or alternative insurance coverage to help cap their out-of-pocket exposure in retirement. So from there, that's where we're going to touch upon Medicare Part C and Medicare Part D. We're also going to review Medigap, also known as Medicare Supplement insurance plans. We'll talk a little bit about how all of these plans work when it comes to your Medicare coverage. So I'm up here now with my whiteboard, and we're going to dive into talking about Part C and Part D. Part C is Medicare Advantage. This is an optional part of Medicare. And then Part D is your prescription drug coverage. So Medicare Part C, Medicare Advantage plans are optional ways to receive your Medicare benefits. They usually include the benefits of hospital, medical, and often Part D prescription drug coverage all rolled into one plan. Medicare Advantage plans sometimes even include extra benefits, things that aren't generally covered by regular Medicare. Things like dental, vision, or hearing coverage is oftentimes included in a Medicare Advantage plan as well. For many people, these will be similar to types of insurance they may have had before they went on to Medicare, like an HMO or a PPO plan. These are managed care plans that use a set network of doctors and hospitals. These plans come with their own copays and coinsurance that they establish for certain services. So for example, you might pay a $50 copay for a doctor's office visit or a $200 copay if you go get x-rays. There are thousands of different Medicare Advantage plans available nationwide, and the plans that you're eligible for will be based on where you live. So in order to enroll in a Medicare Advantage plan, you do have to be enrolled in Medicare Parts A and B. But once you enroll in a Medicare Advantage plan, it kind of replaces your traditional Medicare benefits. Now, instead of showing your red, white, and blue traditional Medicare card at the doctor and hospital, if you have a Medicare Advantage Part C plan, you are now showing your Part C plan's card at the doctor and hospital, and your medical provider bills your Part C insurance plan instead of billing traditional Medicare. So I want to talk a little bit more about Medicare Advantage plans and how they compare to traditional Medicare, because this is the biggest choice that most people will have to make when they go on to Medicare, is whether or not to choose one of these Part C Advantage plans or not. So I really want to go over the pros and cons and how these two compare. So I'm going to erase this real quick. All right, so most people on Medicare are going to have to decide whether to go with traditional Medicare and possibly add on a Medigap, also known as a Medicare Supplement plan, or whether to choose a Part C Medicare Advantage plan. And some people make this choice without even realizing or understanding the consequences of their decision. And that's what I want to explain to you today. First, we're going to break down the costs and how these two plans work, what makes them different, and how to determine which option might be best for you. We already know that if you're enrolled in Original Medicare, Part A is free, but Part B costs $202.90 a month for most people. Of course, that could be subject to income-related monthly adjusted amounts. Now, if you enroll in Medicare Part C, a Medicare Advantage plan, you also still have to pay that $202.90 per month premium for your Medicare Part B. Now, from here, if you choose to stay with Original Medicare, also known as Traditional Medicare, you likely need to enroll in a Part D standalone prescription drug plan to cover your prescription medications. Medicare doesn't require you to enroll in a Part D drug plan, but if you don't enroll in one when you're first eligible and you do want to enroll in one later on down the road, you will get hit with late enrollment penalties. There are many different Part D prescription drug plans available to you, and the best one for you will be based off of which medications you really need coverage for. Medicare Part D drug plans can be as low as $0 a month or as high as $100 or more a month. But for the purposes of this cost comparison, let's just say $25 a month is an average Part D prescription drug plan premium. If you remember what we talked about before, traditional Medicare does come with a lot of out-of-pocket exposure as far as hospital deductibles, co-insurance, co-pays, etc. So most people will want to choose a Medigap, also known as a Medicare supplement plan. And a Medicare supplement plan can be a great option for many because these plans allow you to continue to choose your own doctors and hospitals. They have no network, so you can still go to any doctor in the US that accepts Medicare, and they pay all or most of the gaps in traditional Medicare. So you're left with very little to no out-of-pocket exposure if you do have a hospital stay, a chronic health condition, etc. Medicare supplement plans can vary, and I have other videos that I've linked below that really go into depth about which Medicare supplement plans are the best and how they work. But for today's purposes, I'm just going to say that an average Medicare supplement plan might cost you about $125 a month for a Plan G or Plan N, which are the two most popular plans, depending on where you live. Of course, some people are going to say, no, my premium's lower than that. My premium's much higher than that. We're just plugging this in as kind of an average national cost right now. So when we add this all together, as far as monthly premium costs, this gives us an all-in monthly premium cost of about $353 a month. And what we're getting for this is really the freedom to choose any doctor or hospital we want, as well as have very little to no out-of-pocket costs when it comes to going to the doctor and hospitals. Now, what you're not getting here is coverage for extra benefits that are not covered by traditional Medicare. So things like dental, vision, hearing coverage, typically not covered by Original Medicare and not covered by Medigap. So the Medigap is this premium right here. However, you may want to add on an extra monthly premium of maybe $30 to $50 a month if you want to include dental and vision coverage as well. So let's jump over to Medicare Part C, Medicare Advantage. Now, Part C Advantage plans, you still have to pay your Part B premium to be enrolled in them. But in most parts of the country, Medicare Advantage plans are $0 a month. Now, sometimes they can be more than that, but in most areas, you can find many Medicare Advantage plans as low as $0 a month. And these Medicare Advantage plans typically include Part D prescription drug coverage, and they often include dental and vision coverage as well, and maybe even some extra benefits like transportation benefits. It can vary a lot depending on the plan. So here, our monthly all-in cost is really just the $202.90 per month. The catch here is that now we are on a network managed care plan. So we can't necessarily just choose our own doctors and hospitals. We may need to stay in a certain network. We may need referrals if we want to go see a specialist, and we will have out-of-pocket costs that we will have to pay when we go to the doctor and hospital. So you will have copays and coinsurance, which are established by the Medicare Advantage plan and can vary from plan to plan. And they can also change every year. Medicare Advantage plans do all have a max out-of-pocket, also known as a MOOP, right? Max out-of-pocket limit. This means that this is the total amount that you may have to pay in copays, deductibles, coinsurance before your Advantage plan will kick in and pay 100%. And this maximum out-of-pocket limit is also something that can vary a lot from one plan to another. Now, the maximum out-of-pocket limit that Medicare Advantage plans can have in 2026 is $9,250 per year, but on most plans, it's much lower than that. On most Medicare Advantage plans, you see out-of-pocket maximum limits falling more between $4,000 to $7,000 per year. So when it comes to comparing costs on these two plans, really there's this gray area of the max out-of-pocket and how you're going to use the plan. So if you're someone that uses a lot of medical services, you may benefit by going with something like this that has a higher monthly premium cost, but much lower out-of-pocket exposure. Whereas if you're someone that's really healthy and you rarely go to the doctor and hospital, you could benefit from having the lower monthly premium cost if it's very unlikely that you would satisfy or get close to your maximum out-of-pocket. So when you look at it this way, a lot of people say, well, I'm really healthy right now. Maybe I'll just start off with a Medicare Advantage plan, and then down the road, if I need to go to traditional Medicare and add on a Medigap or Medicare supplement plan, maybe I will, but there's a big catch there. So you cannot always switch back and forth between these two options. And I'm going to talk more about that in a minute. So the choice you make when you are new to Medicare may stick with you for life. And I'll explain why. So when it comes to deciding between Medicare Part C, Medicare Advantage, and going with traditional Medicare and adding on a Medicare supplement plan, this is the one thing that I hear people say to me, I wish I knew this when I was first going onto Medicare. And that has to do with Medicare supplement plan open enrollment periods. So many people falsely assume that all Medicare supplement plans have an annual open enrollment period where you can jump on over to a Medicare supplement plan and get approved for the plan that you choose. And that is just not how it works. In most states in the country, most people get just one Medicare supplement open enrollment period. So you only get one window. It doesn't repeat annually. It's just one. And it's based on your Medicare Part B effective date. So the date that you enroll in Medicare Part B, you have up to 6 months after that Part B effective date to enroll in a Medicare supplement plan without any medical underwriting. And what most people don't realize is once that 6-month window closes, the insurance companies can make you go through medical underwriting to get a plan. That means they can ask you a list of health questions on the application. You have to disclose your medications. They look at your health history in a publicly available medical database, and they can choose whether to approve or deny your application for coverage. So it's not guaranteed that you'll be medically eligible to get a plan if you're not new to Medicare. That's why the strategy of young and healthy, starting with a Medicare Advantage plan, and then later on when you get sick, getting the Medicare supplement plan doesn't always work, because if you do have a health condition or an upcoming surgery or procedure, you're typically ineligible in medical underwriting to get a Medicare supplement plan. Medicare Advantage plans, on the other hand, are not medically underwritten. Anyone can get a Medicare Advantage plan. If you're on Medicare, you can get a Medicare Advantage plan every year. There's a fall open enrollment period. So if you start with a Medicare supplement plan, you can always later on go to an Advantage plan, But if you start with an Advantage plan, you cannot always later on go to a Medicare supplement plan. Now, of course, these rules can vary from state to state, but in most states, that is how it works. When it comes to the four main parts of Medicare, the decisions that you make when you are new to Medicare really can impact your health and your wallet into retirement. So it's really, really important to get educated, understand what your options are. And hopefully this video helps you with that today. Try to simplify things in a way that makes them easy to understand and digest. Medicare is kind of confusing by design. It's the government. They definitely don't make it simple, but my team and I are here to help. We are licensed independent insurance brokers. We work with over 30 different insurance companies. We help people with Medicare Advantage plans, Medicare supplement plans, and we really aim to offer an unbiased service in helping you choose the best Medicare plan for your needs. Best of all, our service is completely free of charge, so you can feel free to call or email us. We would be happy to help. Many people find us right here online. We are not a huge call center. It's really a team of myself and agents that I work really closely with that would love the opportunity to help. So thank you for watching today. Please leave any questions you have for me in the comment section below. I love to hear what you have to say. I try to reply to as many as I can. Thanks again for being here, and we'll see you soon.